So we recently did a study that has more of a long-term focus in a direct sense. Our study specifically was on the potential for the consolidation of local health departments in West Virginia. It was a long-term focus. That's not going to happen overnight. But I think many of the conclusions that come from our study are still very consistent with our more short-term, direct, immediate focus that Madam Secretary and Dr. Gupta are focusing on in their proposed legislation, as well as this is more consistent as well with just their broad vision, as I understand it, for where they're going with improving efficiency in their area in West Virginia. So our study, it comes in the context, of course, of the financial strain that we find ourselves in here in West Virginia, with a very tight budget, with difficulty in increasing revenues, and of course with all the service demands that we have in West Virginia, with our infrastructure needs, with our education needs, with our health care needs, and all those very significant needs. I mean, one of my key points of emphasis is in this context, we can't just accept the status quo. We have to really think outside of the box. We have very stringent public service demands, and at the same time we have limited revenue. We have to think outside of the box. So my mind very quickly goes to our local governments and asking what can we do to enable a whole host of local government units to do the most, to operate most effectively, to be able to generate the most benefit with the resources that we have. I think about local governments broadly, whether it be local public health departments or just county governments or city or municipal governments. I think that, just consider boundaries for one thing. Boundaries were drawn decades ago, or a century ago, or over a century ago. And why do we just accept that these boundaries, these structures, are efficient for us today with our technology, with our economy, with our population distribution? Why do we accept these boundaries that were drawn many, many, many decades ago? There's many reasons to believe that that there could be a lot of gains from restructuring to enhance efficiency, especially with local public health departments. We've looked at research that shows, their study examines in depth research that shows that for a local public health department to really be able to operate efficiently, to be able to deliver services in an effective way and in a cost-efficient way, for that to happen, there has to be a certain critical mass of population. A lot of research shows, and I truly believe that there needs to be a population of at least 100,000 to be able to maximize efficiency for a local public health department. So there's a lot of really good reasons to believe that consolidation would make sense. But overall, we reviewed research. We think there's a potential for a significant cost savings in the long run from consolidation and from many of the other efforts that we have discussed in the big picture. Significant cost savings that can come through enhanced efficiency, significant cost savings that comes through greater purchasing power of a more dynamic, of a more sophisticated local public health department, through the elimination of redundancies. More research is needed to put precise numbers on these efficiency gains, but there's very little doubt in my mind that efficiency gains are there to be had, and I think we're going in the right direction to gain those efficiencies. Not only will consolidation lead to efficiency gains, but it will also lead to an enhanced, more sophisticated delivery of the services that local public health departments provide. That, of course, is sorely, desperately needed, given that West Virginia lags, just as Dr. Gupta mentioned, given that we lag the nation in so many health outcome measures. But third, there's also clearly greater revenue potential from the immediate legislation that we see in front of us, and also from the more long-term vision that I have described. Clear potential for more revenue. The data indicates, again, I'd like to do more in-depth research. There's always, any professor is always going to argue for the need for more in-depth research. That's what we do, that's what we enjoy doing. But even just a quick cursory glance indicates that we have millions of dollars that are sitting there on the table that we could gain from moving the various local public health departments across West Virginia more to the mold that Dr. Gupta has put in place here in Charleston and Putnam County, Kanawha and Putnam counties. As Dr. Gupta said, just very simple changes, and we could see revenues of at least $3-4 million, additional revenues of at least $3-4 million just from bringing the local public health departments across the state up to the standard that we see here in place in Kanawha and Putnam counties. More optimistic goal, if we can move more towards the standards that we see in Mon County, we could talk about revenue gains of $7-8 million just from what are really, I think, very straightforward and very logical and very simple measures to make common sense changes. So again, more revenues, more research is needed, but there's a lot of potential out there, and there's clearly a lot of money that's left on the table that we can gain with some real common sense changes. My full report is available online on our website at WVU's Bureau of Business and Economic Research. Of course, I'll be glad to take questions as well later.